Hey guys, welcome. So the second installment of Bollocks, and today is Bollocks, do I have plantar fasciitis? So it's a overuse injury. A lot of times seen in people, say for example, who suddenly increased the amount of running they've done, or say over lockdown. You've decided to yourself, oh yeah, running's a great idea. I'll go and run. I've never ran in like 5 years. I'll go out and do 3 miles, and then you slowly keep increasing your distance and keep repeating in that, and yeah, and then you wonder why your feet are sore. Uh, so you get these like micro tears in the fascia of your foot. So it's this heel pain that we're talking about. So um, some of the risk factors. So if you've got reduced dorsiflexion, so bringing your foot up towards you. So we'll go. So if you can see me down here, so reduce. That's dorsiflexion. That's plantar flexion. Yeah. So reduce dorsiflexion when you flex your foot up. Pes cavus or planus. So high arches or flat feet. So if you got the extremes of either one of those, foot pronation, where your feet fall in. So more commonly with flat feet, where you get a big flat arch, or when you're running, your feet fall in a lot more excessively. So that kind of repeated load. And again, like I said, weight bearing activities. So if you're on your feet for a long time, or you're doing a shitload of running, but it's generally that sudden increase in activity. People with a high BMI, so if you're overweight, you're at more risk. Diabetes, you're at more risk. Not sure why. And also apparently a leg length discrepancy. So if you got one leg longer than the other, so maybe you've had I don't know, some sort of hip replacement or something. You get a leg length discrepancy. Why you'd be running with a hip replacement, or maybe you've had a hip replacement and you're on your feet for prolonged hours. Then you might develop some plantar fasciitis. And the other thing is you might have very tight or even weak calf muscles, and they're all your risk factors. So the most common thing that people complain of, which I've had today with a patient, and straight away I knew it was plantar fasciitis. She complaining of pain first thing in the morning when you get out of bed, or after, say, you're sitting for a couple of hours and then you get up and you have to kind of walk gingerly because it's quite painful towards the heel. And then, so if we come down here, let's turn this down. Let's do this way maybe. Oh, maybe not. So let's drop this. Of course, I didn't really think about what I was doing here. So, if you can see me there. So, you're getting pain around towards this part of the heel, so which we call anterior part, and medial. So a lot of the pain is kind of in this area here of your foot. Yeah. So the first thing is a tender on palpation. Is it tender to touch there? Yeah, that's a sign that you have plantar fasciitis. Yeah. Is it painful when you stretch it? Yeah, so if you passively stretch it, so if you come in and give it a good stretch, is that painful? Is it painful when you stretch this first big toe? Yeah. So this windlass mechanism, when you stretch that big toe, you're getting pain there. Yeah. And then you might get reduced movement into that plantar fasciitis, is what we discussed earlier. So there is a what we call a knee to the wall test. So if you come here, so if I'm doing my knee to the wall test, so if I'm getting my foot, say, away from the wall, you should be able to get your foot 10 centimeters away from the wall and be able to touch your knee to the wall like so. So 10 centimeters from my toe here to the wall, yeah, and be able to touch your knee to the wall. And that's good range of movement. If you're struggling with that, it's a sign that you've got restricted movement. And that's it. Comment, like, and share. We'll have some more videos in the coming weeks of oh, bollocks do I have, where you can figure out what if you have certain injuries. And plantar fasciitis is probably one of the most common foot related complaints that people go to their GP about. So you want to get it treated early. Then I will do a video on treatment, my favorite exercise for treatment. Again, everyone is individual, and so again, I would suggest seeing a qualified therapist to get a very individual treatment plan. Yeah. Comment, like, and share. All right, bye.